Right now, there are 182 measles cases spread across 9 different states, Texas being hit the hardest. State health officials there say they have seen an explosive 159 cases, including the death of an unvaccinated child. Now, as the number continues to grow, concerns are rising for parents who are hesitant to give their child the vaccine. Joining me now is board-certified pediatrician Dr. Krupa Playforth. Doctor, as always, thank you for hopping on.
Thanks for having me.
You know, post-COVID, there's such vaccine skepticism. I mean, what are you seeing at your practice right now? When parents come to your office, what concerns are they raising to you about vaccines?
So in my practice, which is a little bit of a unique setup, what I've actually seen is more and more parents that are concerned about how to protect their children and coming in or texting me, reaching out, asking if they should get their MMR vaccine early. Especially if they're anticipating spring break travel, which obviously is coming up soon. But I know nationwide we are seeing increasing vaccine hesitancy, and that's partly a result of social media and misinformation. But I think it is exacerbated by the fact that a lot of families don't feel like they have a pediatrician that they know, that they can reach out to, that knows their child, and who can answer their questions.
You bring up the fact about families asking about getting it early. I'm a new mom. I have a 10-month-old at home, so she's not reached the 1-year mark to get that MMR vaccine yet. How concerned should I and other families in my same shoes be about this current outbreak?
If you are living in an area with an active outbreak, even if your child is under 12 months, especially if they're between 6 and 12 months, I think it's worth reaching out to your pediatrician to ask whether or not they recommend getting that first MMR vaccine early. That would be a bonus dose if you do get it between 6 and 12 months. So it doesn't count towards a series. You still need 2 doses after age 1. But if you don't live in an area with an active outbreak right now, and you're not planning to travel internationally, you're not planning to travel to one of those areas, I don't think that there's any reason to panic yet.
Yeah. And as you mentioned, there's a lot of misinformation out there. How can parents decipher between what's reliable, what's misinformation? I mean, we're living in a world on social media with so many different voices coming our way. How do you decipher?
It's really tough as if you're a parent, especially if you're on social media, because you're getting so much different information coming at you from so many different sources. If you're confused and overwhelmed, my recommendation is to try to pick 1 or 2 resources that have the credentials and the experience to back up making recommendations. And hopefully one of those will be your pediatrician. And then to shut out the noise, don't listen to influencers online that don't have any medical background or don't have any basis or foundation for making recommendations. Ask your pediatrician. No parent is ever going to want to do anything to endanger their child, and pediatricians are no different. Ask your pediatrician what they did for their child.
Yeah, and I wanted to ask you a very real question, because I've had this conversation a lot with parents who are all over the spectrum. And in every conversation, there's someone that says your pediatrician wouldn't recommend this schedule of vaccines unless it were safe for your child. And then somebody also always says, but are our pediatricians incentivized by pharmaceutical companies to recommend that? Is there truth to that?
We don't get paid to vaccinate. Honestly, most pediatric practices lose money on vaccinations.
Really?
People go into pediatrics because they care about child health. It's not the most lucrative medical specialty. It is not the most highly respected medical specialty. People go into this field because they love children and they want children to be healthy.
Yeah. And if a patient comes to you and they've said, Dr. Playforth, my family and I have decided vaccines just aren't for us, I mean, what's your guidance for them moving forward?
In my practice, I have the time and the space to really sit down and talk through what their concerns are. I think if you start from a place of compassion and of understanding that every parent really wants the best for their child and is trying to figure out what that is, if you can have the time and space to have those conversations, a lot of times you can really address what their concerns are and talk them through it and reassure them. It's not possible in every medical setting, and not every healthcare office is set up to do it that way, unfortunately. And it won't work with everybody, because there are some families that are truly dug in on not wanting to immunize their children. In my practice, part of what I guarantee my patients is that they're not going to be sitting in the waiting room, risking exposure, and that's a commitment that I stand by. So most of the time, though, you can have these conversations and really reassure families.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.